Hi, my name is Faith Jordan. Student ID is 3630837, and today I will be demonstrating how to clean and medicate a dog's ears for veterinary nursing care fall semester 2024. So first we start off with our otoscopic exam, and you just do that by pulling the ear pinna up using an appropriate sized cone, inserting the cone into the vertical ear canal. Then you want to view the tympanic membrane, which is the eardrum. You're also looking for any swelling, discharge, any abnormalities. So if you can't view the tympanic membrane, you should use a saline solution and not a medicated one. So what we're going to do is a couple different ways. You can put your ear solution on some gauze pads. And I'll hold that pinna up and pull it back just slightly. I'll insert that into the ear canal and massage it in. And you'll do this until you get no debris back out. So his ears are fairly clean, but we do struggle with that sometimes because he does have allergies. And then you want to make sure that they're really dry before medicating them. So I always tell owners to wait about 20 or 15 minutes to clean the ears and then medicate them. Otherwise, it's just counterproductive. The other thing you can do is wet some cotton balls, put them in the ear canal and massage those. You can use a cotton tip applicator to get into the grooves of the pinna and very gently just twist. So he's got no debris. We'll wait 20 minutes and then I'll show you how to medicate. All right, so when applying medication to the ears, you want to make sure to not contaminate the tip of your medication bottle. So this is apply a pea-sized amount into the ears once a day. So I'm going to pull his ear pinna back, visualize the ear canal, drop a pea-sized amount, massage that in. And same thing with the cleaner, you don't want to touch that into the ear canal and contaminate that with whatever infection he has if he had one. Always getting your samples before you clean out the ears, but massage that in, and that is how you clean and medicate a dog's ears. Hi, my name is Faith Jordan. Student ID is 3630837, and today I will be demonstrating how to clean a cat's ears and apply medication. So this is my friend Baby Kitty. He is sedated, but here is the monitor that he is hooked up to. He's alive and well. We did drain an oral hematoma from his left ear. So the first thing we did, or I did, was collected my swab samples for the ear cytology before draining that or cleaning the ear. And then we did drain that, the doctor drained that, and then I'm going to clean the ears out before I medicate. So what I want to do is start with my epiotic, wetting down some cotton balls. And then of course, only use saline if you can't visualize the tympanic membrane. We were able to see that, so epiotic is safe to use. You put that in there, and then you're gonna massage the ear canal to try and break up some of that debris. And then I'm very gently using a cotton tip applicator to remove some of this debris. If you see blood, you should stop. And then you're gonna repeat this until you're not getting any more debris out of the ear. Okay, so now I'm getting to the very end of cleaning the ear. So holding that ear pinna up and back with some slight tug pressure. And I don't have any debris on this cotton swab, so I know that that ear is done and cleaned. What I have here is a dilution of Dex SP to apply to that ear hematoma. And so when doing that, I'm going to splash that right in there and then massage it into the ear. And that is how you clean and medicate ears on felines.
Okay.
Hi, my name is Faith Jordan. Student ID is 3630837, and today I will be demonstrating how to use a rabies restraint pole for veterinary nursing care fall semester 2024. So I've got 2 points that I'm going to hold at. I'll pull back here on this handle to size the loop correctly, and then you're going to twist left, so counterclockwise, to get it tightened to leave it in that spot. So if I'm going into a rabies situation or a very aggressive dog or rabies suspect from a cage, I'm going to open the door as minimal as possible and loop this around the head. And I'm going to pull back and turn to tighten. And now, by keeping both hands on this, I have total control of the dog. So I never want to be more than the pole length away from the dog, and always keeping them in front of me. So if they go that way, or if they're trying to get around, I can push them back this way. But I have total control on where they go, what they do, that they're not getting close to my body or anybody else's. And again, this is a situation you are going to use for a rabies suspect, so a very aggressive dog, or foaming at the mouth, dogs that you are not able to handle, that might need sedation, but you can't even get close enough to do a muzzle. So again, pull back, twist, and then to release it, I'll twist back, and I'll push back. Just like that. Ms. Faith Jordan, student ID is 3630837, and today I will be demonstrating how to apply a modified Robert Jones bandage and a splint for veterinary nursing care fall semester 2024. So things that you will need are your gloves, your splint, your wooden sticks, a Sharpie, stretch gauze, conforming pads. You will have your vet wrap, non-adherent pad, and 1-inch porous tape. So the first thing we're going to do is place our stirrups. So you will need your wooden sticks and your tape. So we're going to start here, and we will apply 1 wooden stick, and then going on the medial side here, we will do the same thing. So it's okay. All right. So now that we've got that in place, we're now going to take our non-adherent pad, and we're going to say that he is injured near his hock or lateral saphenous vein. So we're going to place that here. Then we're going to take our cast padding, and starting distally, working proximally, we're going to roll this up, and then we will keep the limb covered about halfway each time. So we're going to roll it counterclockwise. So we're going to start below the injury. Making sure we keep our toes exposed. And then this will secure our non-adherent pad. And typically 1 layer is enough. All right, so next I'm going to take my splint here, and I'm going to place it. So you want to make sure that you are isolating the joints above and below that injury. So if he's injured on his hock, that is where we would want to have his foot stabilized and his stifle. Additionally, ideally, if he had another injury to this spot, we wouldn't want to necessarily cover that with a splint, but for these purposes, we're going to. So since we are saving on materials, normally there would be, you'd place your modified Robert Jones bandage, you would apply 5 layers of your conforming padding, and then you would place your splint and then continue similar steps. But since we are saving on supplies, we're just going to do the 1 layer, and then we will work in our stretch gauze. So again, making sure that our toes are exposed, starting distally. We're going to take our stretch gauze, and you want to leave about 1/4 of that layer exposed. So and then to save on costs, we did not cut this splint back. We have a few things on back order. So ideally you would have this cut, and you would keep your cast padding exposed 1/4 inch. The other thing too is if we did have to cut this down, we would want to file it, because this can be sharp. It can leave injuries, rubbing injuries to exposed layers there. So, all right, so now we're going to take our stirrups that we've left in place here, and we're going to twist and pull back up towards the leg, because that is going to keep this in place. So, and then again, twist. Now we're going to take our elasticon. I have pre-stretched it and rolled it back up. This can be very tight, and especially with movement as the body swells, this only gets tighter around the location it's applied. So remembering to keep it loose when placing it is ideal. So again, starting distally and working proximally. And we want to leave about 1/4 inch of the previous layer exposed. If this was just a modified Robert Jones bandage, 1 layer is fine. So all right, so I've got my 1/4 inch below, 1/4 inch above. Now you will take your 1 inch porous tape or elasticon, and you're just gonna secure the top and the bottom. Again, leaving some of that exposed. Now with your Sharpie, typically you would indicate the site of injury. So since we wouldn't place a splint over anything that was lacerated, or we would try not to, if his injury is on the inside, you would put a heart there, and then your initials for placing it and the date. That way they know when it was applied. Again, keeping those toes exposed. That way you can instruct owners at home to check on them for swelling, discoloration, if they're cool to the touch. And then of course informing them to check, just to peek inside the splint if they're able to, making sure that there's no foul odor or redness around the area for at-home care. All right, so removing a bandage or splint, you're always going to start when you cut with your bandage scissors, proximally working distally. For removing the splint, there's a couple different ways you can do that. I can take where my layer of conforming or stretch gauze up here starts, and I can insert my bandage scissors and cut down along the splint. That way I know I'm not on any skin. If this were just the bandage, you know you would not have to worry about removing the splint, but for that purpose, we're going to make this modification. So now that that's off, we can pull the splint off, and then we've just got our stretch gauze. So like I said, if it were under the splint properly, we would have another complete bandage there, but because we're saving on materials, and again, cutting down. And then removing our tape from the stirrups. And that is how you would apply a modified Robert Jones bandage and a splint. My name is Faith Jordan. Student ID is 3630837, and today I will be demonstrating how to apply an emergency bandage to the chest for veterinary nursing care fall semester 2024. So first thing we're going to want to do is we're going to want to unroll our vet wrap to loosen it up. And then re-roll and attach. All right, and then we've got our non-adherent pad. So it's facing the other way, so you can see the spot on his chest. All right. So the first thing we're going to do is this little patch here. That's going to be his wound. We're going to take our non-adherent pad. You can use gauze if you need it, and you would apply. Typically 1 layer is sufficient when applying these. You don't want it to be too tight. So again, covering half of the width of the previous layer, and I want to go up some just to get in front of where that wound would be. Okay. Then we're going to take our stretch gauze and do the same thing, go over by 1 layer. And sometimes you do need multiple rolls. He is a big dog. Okay. Next, Next, we're going to use our vet wrap. So keeping, again, one layer. And again, this is something that with movement can get pretty loose. So we want to keep it fairly tight. I mean, this is something with movement that gets tighter, so we want to keep it fairly loose on the body as we wrap it. And then lastly, we are going to take our elasticon here, or our porous tape, and we are going to do one layer around the top and one around the bottom. I'm gonna pause that. All right, so this is what it looks like at the end of it. You've got your porous tape covering for security, and then you would write your initials and the date that it was placed for removal. We are going to cut proximally to distally with our bandage scissors.
I feel like this is a normal irritating day where we come in and it's what it's like. I think maybe
And
yeah, truly. I love it.
And that is how you apply and remove an emergency bandage to the chest.